Hey guys, welcome to my video. My name's Charlene Douglas. I'm the TV counsellor on E4's Sex Clinic. Today I wanted to talk about the three main issues that men usually come to my private practice for. Number one, erection issues. Number two, issues around ejaculation. So that could be premature ejaculation or delayed ejaculation. And three, any kind of issues around porn addiction, sex addiction, or anything to do with am I a perv? So let's delve into the three issues a little bit further and I'll give you some tips on how to deal with each one. So let's first start with erection issues. So you might find in terms of erections that on occasions you will have maybe semi-erections or sometimes no erections at all, and that's perfectly normal. What you might find is that it might be due to maybe alcohol consumption, it might be due to feeling quite stressed within your relationship or at work. All these things are perfectly normal. What can happen though is that you then tell yourself you have a problem and start Google searching, I've got a problem with my penis. What is then often advised is that you take Viagra. Now, I'm not saying Viagra isn't a good medication to take on occasions, but if you find that you're reliant on it or that you're hiding it from your partner, then I'd really advise to get some professional help. So I would suggest if it's been a problem for a while, then definitely go to see your GP just to rule out any kind of medical cause. So what you find that might happen is that you will have an erection issue once or maybe twice. You will then tell yourself that this is going to happen every time you have sex. And because you're telling yourself it's going to happen, of course it happens. We call this performance anxiety, and it can be really difficult to get out of that loop. So what can you do to get yourself out of this loop? So one of the first things that I would advise would be to speak to your partner about it. It must be so stressful to be in a situation where you're taking Viagra secretly or you're on Google looking for the remedy to this problem. Speak to your partner about it, have open conversations. Maybe a conversation needs to be had about the type of sex that you want to have. Maybe it's not turning you on. Maybe there's a part of you that just want to tell your partner that it's not turning you on. But what you'll find is that when you have that conversation with your partner, she or he will feel open and able to meet your needs, and what you might find is that the erection might come back. Another thing that you can do is really think about what it is in your life that's causing you anxiety. If it's not your relationship, it might be stress at work. Are there things that you can do to make sure that when you come home from work, you're not tired? And of course, taking care of yourself, making sure you don't drink too much alcohol, making sure that you are exercising, making sure you're maybe meditating or doing some yoga, whatever you need to do in order that your body feels relaxed and ready for sex. What you might find is that you're having sex and it's not the right conditions for you. So maybe the room's too warm or too cold, or maybe there are concerns that the neighbours can hear. Whatever thoughts are going through your mind, that can have an effect on how you perform sexually. In saying that, I don't particularly like to use the word perform because it makes you think, okay, this is a performance, and it's not, it's an experience. So there are many reasons that you can experience erectile dysfunction. What's really important is that you speak to a professional like me so that we can establish what the real issues are for you. Number two, issues around ejaculation. Now this could be premature ejaculation or delayed ejaculation, often described as I can't come at all, or sometimes I come a little bit too quickly. So surprisingly, medically speaking, premature ejaculation is considered coming before a minute of penis to vagina entry. This doesn't help a lot of men out there, I know, because a lot of men want to last a little bit longer and assume that their partner wants that too. So what are the causes of premature or delayed ejaculation? So we go back to anxiety again. Now, you're probably thinking, I'm not anxious, I'm fine. And maybe that's what you're feeling, but it's very possible that your body isn't feeling that. So whether it is due to work, whether it is due to your family, whether it is due to your relationship issues or money worries, there may be something that's really bothering you that's not allowing your body to really relax. An anxious mind can send a message to the brain to fire in terms of ejaculation way before you are ready for that to take place. What can you do about it? Well, it's about relaxing. It's about enjoying the sex that you're having. It's about having a great conversation with your partner, enjoying foreplay. If you notice that you're about to ejaculate, is it possible that you can change position halfway throughout your sexual experience with your partner? Or is it possible that you can maybe make sure that you sexually please your partner first, so your partner comes first, and then you can ejaculate whenever you want to, then there's no pressure. So you might have seen on E4 Sex Clinic, we spoke about edging. This is also sometimes known as the stop-start method. How do you do it? So basically what you need to do is you masturbate until you get to that point of no return, and then you allow the erection to go by removing the stimulation. You do that a few times during the week. You'll then realise that your penis has become used to controlling ejaculations. So when you then have sex with your partner, your body, your penis knows that it can control when it ejaculates. So let's look at delayed ejaculation. So if you're not having the right types of sex, it's very possible that you're not going to feel stimulated or aroused. Your body doesn't lie. So maybe it's about having a conversation with your partner and being really clear about what it is that really turns you on. Maybe it's about exploring fantasies together. Maybe it's about ensuring that the environment in your home turns you on. So how do you do this? So there could be a number of ways that you can do this. You can get a diffuser with some beautiful lavender that makes a room smell really beautiful and really sexy. Maybe it's some nice music, some let's get it on type of music. Or maybe it's about making sure the room's warm, turning down the lights. Maybe you need to do a bit of role play. It's about really being clear with yourself and with your partner. What is it that really turns you on so that you can really enjoy the experience and that you can ejaculate when it is that you want to. So with premature ejaculation and delayed ejaculation, it's really important that you speak to a professional to make sure that you're dealing with any psychological impact that some of these issues might cause. And number 3, porn addiction and sex addiction. Now, in the world of psychology, there are lots of debates about whether there is such a thing as sex addiction. Let's put aside whether there is such a thing or not. What's really important is if you feel compelled to watch porn or compelled to have sex, then for you, it's an issue. If, for example, you're at work and you're thinking about porn, or someone's walking past and you're watching their breasts, or maybe you're talking to your friend about the weather and you're thinking about sex as they're talking, you know if it's a problem for you. So what are some of the ways that you can overcome these issues? So if this relates to you, I would advise that you seek some help from a professional. I would also add the compulsion to masturbate extremely frequently may also be an issue for you as well. What's really important is to look at not that it just meets a pleasurable need, but what other need it meets for you. Maybe there's an avoidance of intimacy. Maybe you're feeling really lonely and really isolated, and this provides a sense of warmth and comfort for you. I would strongly advise to speak to a professional just to find out what that may be. There are, of course, many different techniques that you can try to avoid watching porn too much or to avoid sex addiction. There are various accountability apps, which means that a friend or a trusted family member will receive a notification on their phone every time you access a site. Those things help to not want to watch porn, but what's really important is to look at the psychological issues, and let's delve deeper into what some of those issues might be for you. So let's look at those 3 issues again: erectile dysfunction, premature or delayed ejaculation, and porn addiction, sex addiction, and we'll add the compulsion to masturbation also. So if you relate to any of these 3 issues, I offer a free consultation, so please get in touch and let's see how I can help you.